Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be looking at pulmonary hypertension, a condition where the blood pressure in the arteries of the lungs becomes abnormally high. This makes the right side of the heart work much harder and over time can lead to heart failure. It's a serious condition, but with early detection and new treatments, outcomes are improving. To help us understand what it is, why it happens, and what therapies are available, I'm joined by my colleague, Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being here.
Well, thank you for having me. It's a privilege.
So let's talk about pulmonary hypertension. Everybody knows about hypertension, but what's pulmonary hypertension?
Pulmonary hypertension means that the arteries in the lungs have been narrowed, stiff, or blocked. This raises the pressure inside the lung vessels and forces the heart to pump harder to push the same amount of blood through. Over time, this strain weakens the heart, and patients can experience shortness of breath, fatigue, and chest pain, often with swelling in the legs.
What are the different types of pulmonary hypertension?
Well, they're classified into 5 different groups. The first group has to do with the autoimmune disorders. Congenital heart problems and genetics impact the arterial system of the lungs. The second group is due to the left side of the heart, and that left ventricle is what pumps the blood out to the body, and that's caused by conditions like heart failure and valve disease. The third group, which is the pulmonary hypertension due to lung diseases, chronic obstructive pulmonary disease, interstitial lung disease, and often sleep apnea. The last group is pulmonary hypertension due to chronic blood clots. Old clots block arteries and cause a lot of problems. And of course, there's the catch-all group. It's unclear causes. In other words, we honestly don't know. It's real rare things.
All right, let's go over those again because I want people to know. First of all of them have the same symptoms and signs. Is that true?
They're all creating an increase in pressure in the lung vessels.
But do they all present with the same shortness of breath, fatigue, or is there something that slips in where you don't know?
The latter. There's some that can present subtly, and then you end up dealing with a very consequential problem.
Okay. All right. So to continue, what are the triggers of pulmonary hypertension?
That's a great question. The causes depend on the group. So autoimmune disorders, chronic lung conditions, heart problems, and blood clots are common triggers. Genetics can also play a role, but it's not as common.
So what are the genetics just impacting?
Well, the genetics are mutations in the genes that increase the risk of developing pulmonary artery hypertension.
Okay.
However, not everyone with a genetic change will develop the disease. Environmental and lifestyle factors also contribute.
Well, let's talk about traditional Chinese medicine. How do they view pulmonary hypertension?
TCM views this as a condition of Qi, i.e. an energy deficiency, with stagnation of the blood in the chest. Treatments are aimed to improve energy flow and reduce fluid buildup. Acupuncture points to lung and heart meridians may be used along with herbs to strengthen the lungs and circulation.
Well, how do you diagnose pulmonary hypertension in your office?
Well, the gold standard is often done in a hospital with heart catheterization. In an office, that is not the case because we don't do catheterizations. Because the catheterization can measure the pressure directly in the pulmonary arteries. But there's other tools. If you have echocardiography, ultrasound, and somebody that knows how to not only do it but read it, you can do it as an ambulatory patient in an office. CAT scans and many blood tests can indicate heart strain. And of course, pulmonary function tests are very common, so you can get the input of those that are having difficulty taking a big breath or blowing air out.
All right, so now let's talk about the standard of care for pulmonary hypertension in the United States of America.
Well, those treatments depends upon what group you're in, so we know which medications are available to treat vasodilation or endothelial receptor antagonist. And oxygen therapy for those with low oxygen levels is a lifesaver. And blood thinners for people with chronic clots can easily eliminate the recurrence of those. In severe cases, lung and heart-lung transplants may be evaluated to see if they're needed.
Hope we don't get that far. So how about regenerative therapy first and not get to the end stage of your lung having to be replaced?
Well, absolutely. Those are still evolving and many experimental, but the regenerative cells reduce inflammation and improve and repair blood vessels. So they promote healing, especially exosomes, the tiny vesicles. They get into niches and nodes, they're nano size, so they reduce scarring and promote healing. And the gene therapies, especially the trials that are exploring ways to restore normal function in those genes, CRISPR and others, are doing an excellent job. Peptides, of course, that's being studied for their ability to relax the pulmonary arteries and improve circulation.
I'm going to make you talk about these little exosomes that you keep talking about, where they're tiny vesicles that may help reduce scarring and promote healing. You keep talking about this when you talk about your regenerative therapies. What do you like better? If someone had to choose and pay for exosomes or peptides, what would you say?
Exosomes are more expensive than peptides, but peptides act faster. And since they're the proteins from within your own body, in either case, you rarely have any reactions to them. We haven't seen any. But I would say if you had to choose between an exosome or a peptide, you'd probably start with a peptide because your results would be faster.
Okay, just want to plan ahead. All right, so now what lifestyle strategies do you suggest to your patients?
I think we begin with exercise, light exercise, supervised that maintains strength. And next we address sleep. Sleep is essential for our daily balance. It makes a big difference. And if they have any sleep apnea, gasping and things, we definitely need to treat that. The diet reduces salt to lower the fluid buildup, and stress management assists with better relaxation techniques to lower the strain on the heart. Fluids to keep us hydrated, monitor intake, and prevents overloading the circulation.
So what's your mnemonic for your patients?
Well, that's a real easy one because we use the word heart.
H stands for?
Healthy lifestyle.
E.
Early detection with tests.
A.
Adherence to medications.
R.
Regular follow-up with your physicians.
T.
Transplant or advanced therapy when needed.
And of course, I want you to address the long-term outlook for people who are diagnosed with pulmonary hypertension. What are they looking at?
Their survival rates have significantly improved and the quality of life can be improved as well. With the right care, most patients live an active, fulfilling lives.
Well, thank you, Dr. Henderson, for guiding us through pulmonary hypertension. If you or someone you know experiences unexplained shortness of breath, fatigue, chest pain, do not ignore it. Seek medical attention early. It can make all the difference. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.